Hi, this is Dr. Zachary Pearce with Michigan Oculofacial Specialists and myeyelidexpert.com. In this video, we're going to review the typical postoperative instructions after eyelid surgery. You will receive a copy of these instructions prior to your surgery as well as on the day of your surgery. That way you can reference them before the surgery and know what to expect and during your recovery period. We'll review them in detail here to help your understanding. If you do not have a postoperative appointment, you can call the office to make one. I will typically want to see you about 6 to 10 days after the surgery to remove any sutures. Although the risk of some serious complication would be extremely uncommon with these types of surgeries, I want you to know that we'll be available if there's concern. If there's a sudden loss of or change in vision, I'd want you to call us. Additionally, if there's a sudden hemorrhage or massive bleeding or swelling, that would be a reason to call immediately. During office hours, I want you to call the office numbers as listed here. For nights and weekends or after hours, if the office is closed, you can reach me directly through the emergency number listed here. Immediately after surgery, I want you to go directly home and limit your physical activity. You should not drive or make major decisions within the first 24 hours. And I want you to start with cool compresses, 20 minutes on and 10 minutes off while awake. Regarding wound care, you may have some minor bleeding or oozing from the stitches for the first 24 hours. If this occurs, you can use cold, direct pressure for 5 minutes when needed. If you're concerned, call as mentioned above. For the first 48 hours, I want you to apply these cool compresses every 30 minutes, so 20 minutes on, 10 minutes off while awake. You can use gauze pads dipped in icy cold water or crushed ice in Ziploc baggies. On our website, you can see another video for a way to make cool compresses at home. After the first 48 hours, you can decrease the use of your cool compresses to just as needed for the first week. You can also apply a very small amount of Vaseline on the incision line about once a day for 5 days. Do not pull or rub on the eyelids or surgical areas. It's not uncommon for the eyes to feel scratchy or dry after surgery. We recommend using over-the-counter artificial teardrops, usually 3 to 4 times a day. We also recommend using an artificial lubricating eye ointment once or twice a day, but it should be noted that this can cause blurriness to your vision. We recommend using an eye shield at bedtime while you sleep for the first 10 days. This will be given to you on the day of your surgery. You can apply a single piece of tape to hold that in place. And lastly, we recommend no contact lenses for the first 2 weeks. Regarding medications and pain control, luckily these types of surgeries tend not to be very painful, so most of the time pain is well controlled with Tylenol and the ice packs. We recommend using Tylenol or acetaminophen as needed for pain, and you can reference the instructions on the packaging. I do not want you to use aspirin, NSAIDs such as Motrin, Advil, ibuprofen, etc. for the first 2 days because this can increase the risk of bleeding and bruising. If you are on prescription anticoagulation medication, I will list the postoperative instructions of when to restart here. All other prescription medications should be resumed at the next scheduled dose after surgery, so that could be later that day or the following day. And other vitamins and supplements can be resumed after 2 days. Regarding physical activity, I recommend you elevate the head of your bed for the first week. This can also help minimize the swelling. You can shower the day after surgery, but avoid getting the surgical areas very wet. You should avoid straining, heavy lifting, or prolonged bending for the first 2 weeks. Some casual walking is permitted after the first week. And I recommend no eye makeup for the first 2 weeks since this can tattoo an incision. Hopefully this helps understand a little more what to expect in the postoperative period after eyelid surgery. If there are other questions or concerns, please reach out and give us a call. Again, you will receive these instructions prior to your surgery and the day of surgery. Best of luck.